Now, WION is in fact the only Indian news network that's been reporting on the novel coronavirus outbreak from day one, the time that it was first reported in Wuhan in China. At this point of time, there is a bit of panic in India after more cases have come to light. So what are the symptoms of this particular infection? What should one do if they are feeling unwell? Like we've been saying, prevention is better than panic because there is no cure for the novel coronavirus infection at this point of time. So we've compiled a list of the frequently asked questions and also their answer, information that you can actually use in the fight against the novel coronavirus. Now, the first question which a lot of people are asking is, what are the symptoms? Now, those who've been infected, and this is important to remember, they suffer cough, and it's said to be a dry cough. There's also a high fever. Someone should have a fever that is more than 104 degree Fahrenheit, and they also experience breathing difficulty as well. Now, the symptoms could take up to 14 days for an individual who's been infected for him or her to display, and the novel coronavirus also often leads to pneumonia, runny nose, which is typical of a cold and has not been reported as one of the symptoms. This is said to be one of the first key symptoms that one should be looking out for. But these, again, are symptoms that are witnessed in common cold as well. Now, the second question, what can you do if you're feeling sick? Now, the WHO, the World Health Organization, recommends heading out to your local hospital for the right advice. Now, Indian citizens can, in fact, take some added steps as well. The Government of India has set up a 24/7 helpline number and an email ID. We're running that on the bottom of our screen. So if you or anyone around you feel that you need to have a little chat with some expert, then you can obviously call in this 24/7 helpline that we are displaying on the bottom of our screens right now. This is a government-run helpline. Do call in and get all the answers from there as well. And also, one of the other important things to do if you feel that you may have contracted the coronavirus is to stay indoors and avoid public places. Now, the third question is, how deadly is the novel coronavirus infection? Now, diseases like what happened in the case of SARS and MERS belong to the same family as this novel coronavirus. And the Wuhan coronavirus is said to be deadlier than the seasonal flu, but not as deadly as SARS. Now, the global rate of mortality is said to be about 2 to 3%. The mortality rate in the case of SARS was nearly about 8%, while in the case of MERS, which recorded the worst fatality, the rate was almost about 35%. That is to say, if 100 people got infected by MERS, about 35 of them were likely to succumb to the infection. In the case of the novel coronavirus, out of 100 people, if they were to get infected, only about 2 or 3 of them will succumb to the infection, and therefore it is not being said to be very fatal, but it travels very fast. Now, the most commonly asked question, of course, is, do face masks actually help? Now, in this case, it's important to remember, face masks don't guarantee total protection. Experts do recommend using one. The virus is transmitted through droplets when someone sneezes or if someone coughs. So if you're close to someone who is displaying some symptoms of the coronavirus infection, like incessant dry coughing, then masks can, of course, help in preventing the spread of the disease. And if you feel that you are exhibiting any of the symptoms, then wearing a mask can protect others. And also, one of the other questions that is asked a lot is there a cure? Now, so far, there is no cure. There are no approved drugs for the novel coronavirus. A lot of people are banning about some bizarre kind of cures, but none of them actually work. Now, there are several medicines, etc., that are still in the process of being tested. A vaccine could come about, but this will take anywhere from 12 to 18 months before it actually is available. So how are doctors treating the novel coronavirus patients? Well, according to reports from the last month, the doctors are using a combination of drugs and different methods to treat the patients. Reportedly, more than 50,000 patients infected around the world have recovered. in terms of what has happened post having had the novel coronavirus infection. Now, finally, we'd like to suggest some precautions as well. How can you protect yourself? Well, wash your hands. This, of course, cannot be overemphasized. Wash your hands repeatedly with clean water and soap. Meticulous hand washing is, of course, the best available option. If that is not possible, then one may use wipes or hand sanitizers. The other and very important thing that you need to do is cover your mouth and nose if you were to cough or sneeze. Now, seek medical help if you have a fever, cough, or if you're experiencing any kind of difficulty in breathing. And also share your travel history with your doctor during the checkup. Now, if you are someone who has, in the recent days and weeks, visited any of the affected areas, then avoid direct, unprotected contact with live animals or surfaces that were under contact with animals. Avoid eating raw, undercooked food. That does not mean that you need to avoid all non-vegetarian food altogether. As long as one is properly, of course, cleaning and cooking food items, they are safe. So if anyone is telling you to not eat non-vegetarian food, that is not a problem at all in terms of the spread of the novel coronavirus. Meanwhile, in an exclusive interview with WION, the World Health Organization's chief scientist, Dr. Soumya Swaminathan, explained the nuances of the spread of the novel coronavirus. She's urged people to be very proactive and has also stressed upon the need to collect data. Listen in to what she had to say.
That is impossible to say without further data. And so some countries have put in place surveillance systems based on other surveillance that they have. For example, some countries have surveillance of influenza-like illness. And it's possible then to test those samples which are negative for influenza for this new coronavirus. So there could be groups of individuals, especially high-risk ones, that surveillance could be extended to in order to get a better idea of whether there's any community transmission going on at all. There are also sero-epidemiological studies which would be very useful. So these are blood tests which would look at antibodies for the virus, and the first few blood tests have been developed. That would again tell us whether there's been a wider exposure to this virus in the community or not. So at this point of time, the data is very limited, but I think we have to be maybe proactive and extra cautious and explore every possibility and try to gather as much data as possible.
Meanwhile, Italy is announcing